Hey guys, hope you're all doing well. I just want to quickly come on here and answer all your questions about being a hospitalist. I tried actually putting it in an Instagram post, but there's a word limit, so I wasn't able to fit everything in there. So I'll just start answering your questions. So first things first, what is a hospitalist? So a hospitalist is a physician who takes care of a patient from the day of admission all the way to the day of discharge. They manage the entire care of the patient throughout their hospital stay. The second question is, how does someone become a hospitalist? So there is different routes that you can take to become a hospitalist. You can either finish an internal medicine residency program or you can finish a family medicine residency program. One thing I didn't know is that you can do a family medicine residency and become a hospitalist. However, I have come to find out that there are a lot of family medicine residency programs that are more hospital-based than outpatient-based, so you'll find a lot of the graduates are more comfortable being hospitalists than primary care providers. The next question that I do get is, what's the difference between an internist and a hospitalist? So an internist is someone who finished an internal medicine residency program. Once you're done with internal medicine residency, there are multiple options that you can choose to take. Either you can go into a fellowship and you can pursue nephrology, hematology, oncology, gastroenterology, or cardiology, etc. Or you can work as a primary care doctor, which is the outpatient setting. Or you can become a hospitalist and work in the hospital, inpatient. Or you can work in an urgent care, or you can work, or you can do traditional medicine. So traditional medicine, by that I mean you see patients in the office, which is outpatient, and then if any of your patients get admitted into the hospital, you do inpatient medicine. So you follow those patients into the hospital and you still take care of them. So you're doing outpatient and inpatient. And those are the things that you can do if you finish an internal medicine residency program. So really there are so many different schedules, but the most common one that you will find is the 7 on, 7 off schedule. So by that I mean you work 7 days in a row and then you get 7 days off. During your work days, you work 7 in the morning till 7 p.m. at night. So you work 12-hour shifts for 7 days in a row, then you get your 7 days off. Those 7 days off are your vacation time. You do not get any paid time off on top of that. However, there are different types of schedules, especially if you're going to work in an academic setting where you're working with residents. You will find that there are schedules that are Monday to Friday, where you work from 8 in the morning till around 5 p.m. in the evening, and you're on call maybe 1 weekend a month or 2 weekends a month, and you also get paid time off on top of that. And there are also hospice schedules where you do that 7 on, 7 off, but you're not expected to be in the hospital till 7 p.m. every day. And then there's the schedule that I have, where it's considered a flexible schedule, where you work 14 days a month, 14 shifts a month. Some months I do work extra, but that's considered like overtime. But other than that, there's 14 shifts a month, and that 14 shifts can be scattered throughout the month. And then in between that, you get your days off scattered as well. What are the pros and what are the cons of being a hospitalist? So I think one of the pros of being a hospitalist is that you always work with a team. Whether you're working with residents or you're working with nurse practitioners and physician assistants, or if you're working alone as well. Like, let's say you have a case of heart failure where your treatment isn't working and you feel like you need the help of a cardiologist, you can always get a cardiologist involved. So you're always working with other people on the team. You're never really alone, and I think that's really helpful. It's especially if you're someone straight out of training, it's always good to know that you're not really alone in the beginning. The other benefits of being a hospitalist, I think one of them is actually the schedule. Even though it can be difficult for people who have families or who have kids to have such a rigid schedule where they're working 7 days in a row, but if you're able to fit your personal life with your schedule, I think having a good chunk of the month off is really enjoyable. But that really also depends on your personal life. Another benefit of being a hospitalist is the growth that you can have within the hospital system. You can be a member of a lot of committees, you can help instigate change within the hospital system, and you can start taking on more administrative roles and grow within the hospital system. And I think that's also a benefit to consider when you're considering becoming a hospitalist. What is the downsides of being a hospitalist? I think one of them is also the schedule. Like working 7 days on, 7 days off can burn people out eventually. Like maybe because I'm only 1 year in, it hasn't burned me out. The other thing is, like you said, I'm not really working 7 days in a row. I'm taking 7 days off. I have a flexible schedule, and I only started working this kind of schedule in July. But I do know that there are a lot of people who get burnt out and they do find different jobs eventually. Like they'll try to do the Monday to Friday schedule or start working part-time. So especially when people start having kids, it can be difficult. Like a lot of people can't work 12-hour shifts and get home at 8 p.m. for a week when they have kids. So that can be kind of difficult. But like I said, there are so many different types of schedules that you can find something that works for you. It's just going to be difficult to find one. You know, there's a lot of research and a lot of job hunting that's involved. So a couple of questions that people ask me on Instagram is, what is the pay of a hospitalist? So that also depends on the location that you're working and whether you're working in an academic versus non-academic setting. So if you're working, let's say, in a city area, you'll get paid less. If you're working in a more rural area, you'll get paid more, for instance. It can really range from $160,000 to $300,000. Like, I know people who make both, you know. I'm neither of those people, but there are people who make 300K, there are people who make 160K. The average is actually around $230,000. Now, the other thing that people ask is, what is the ideal route to become a hospitalist? Would you take an internal medicine route or a family medicine route? Here's the thing, I'm biased. I did an internal medicine residency. So I think, in my honest opinion, I would do an internal medicine residency once again. And here's the reason why, is because I know there's always an option for a fellowship. Let's say 5 years down the line, I decide I'm done with being a hospitalist. This isn't a job for me. I actually found a specialty that I really, really like and would like to pursue. There's always that option. I can become a cardiologist, a nephrologist, etc. So I think that's kind of one of the benefits of doing internal medicine. I don't really know what are the fellowships that you can pursue if you do family medicine. That's the thing. I haven't really done any research about that. But if any of you guys watching know, make sure you mention them down in the comments below to help other people out. The other question that you guys asked is, what's the difference between a nurse practitioner and a hospitalist? So both a hospitalist and a nurse practitioner can practice hospital medicine, but they each have a different training and different role. So a hospitalist is a physician, a doctor who trained in, like I said, either internal medicine or family medicine. A nurse practitioner is a nurse who went to graduate school and became a nurse practitioner. I don't really know much detail about the training, so I can't really help you guys if you have any questions about that. They both practice hospital medicine. So I work actually with nurse practitioners. They do see patients independently. I don't really get too involved with their care unless they ask for any questions. I oversee their care, but don't really go examine the patients that we're seeing independently. So if they feel like they have any concerns about a patient or they want a second opinion, they always come and ask me questions. But we do work together as a team and both can actually practice independently. I hope that kind of answered your question. I'm not really sure if you had any further questions about nurse practitioners. I don't really know much other than that. I do work with some, but I don't really know anything about the training per se. So how do you know if being a hospitalist is for you? So if you're someone during your internal medicine residency realizes that they like all of medicine, they can't really pick one specific specialty, I think obviously this is a great option. If you like treating acute conditions, if you like diagnosing patients, this is obviously a great option for you. If you like doing procedures, that's not something I mentioned before, but obviously as a hospitalist, you can do central lines, arterial lines, you can do lumbar punctures, paracentesis, arthrocentesis. You just need to be credentialed in your hospital and you can do all that. If those are things that you are interested in, then obviously being a hospitalist is a great option. Alright guys, I hope I answered all of your questions. If you have anything that I didn't answer, make sure you leave them down in the comments below. Make sure you hit the like button or dislike button, anything helps really. And make sure you subscribe to my channel, and if you have any video suggestions, please mention them in the comments below. Alright, goodbye!